Lipedema is a medical condition which is seen in approximately 10 to 15% of the women globally, and it is exclusively seen in women. And in India also, we have approximately anywhere from 5 to 25% of the women who suffer from lipedema. Usually it could be as an isolated lipedema, or it could be in combination with obesity, so and is confused as obesity. Even though this disease was identified in 1940 by Dr. Heinz in Germany, this particular condition was not entered into the International Classification of Diseases until 2019 by WHO, because of which it has not been taught in medical colleges, and the awareness about lipedema is very minimal in the medical fraternity, let alone the general public. So now this particular condition is seen where the upper body is narrow, the waist is narrow, but the lower half of the body, that is the buttocks, hips, thighs, legs, start to increase in size, starting from any time from puberty, during pregnancy, during any complicated major gynecological surgery, or during menopause. There are 5 types of lipedema. Type 1, where the hips are very large and keeps growing. Type 2, where the hips and thighs keep growing. Type 3, where the hips, thighs and the legs keep growing. And surprisingly enough, you generally notice that the feet are spared, and there is something like a cuff called the ankle cuff that forms, and in 30% of those patients who suffer from lipedema, the arms and forearms also do deposit abnormal amounts of fat. These patients have an inherent weakness of the lymphatic system and sometimes even the venous system, and may develop spider veins or varicose veins. There is the swelling is seen bilaterally symmetrical, and the legs, thighs, hips or the arms grow symmetrically in nature. There is associated pain and tenderness in the region, and those patients who have this, because of this particular pain, it is also called the painful fat syndrome. These patients also tend to bruise very easily, and with the slightest of trauma they form large hematomas, and which is seen by the patient a few days later. Surprisingly enough, hair does not grow in those areas which are affected by lipedema. Those areas which are not affected by lipedema, there could be hair growth. So, and it has also been seen that there is some amount of protection from diabetes in these patients who suffer from lipedema. Lipedema can be otherwise seen diagnosed in patients in women who have a pear-shaped body, and when associated with obesity, they find it even more difficult for them to maintain a healthy lifestyle. These patients with lipedema do benefit out of lymphatic dry brushing, lymphatic massages, compressive therapies, sequential compressive therapies, exercise in water, swimming, and also a ketogenic diet and intermittent fasting. Those patients with lipedema, isolated lipedema, do not benefit greatly from bariatric surgery. Those patients who have obesity along with lipedema would benefit from weight loss, but those areas affected with lipedema do not change grossly as expected following a bariatric surgery. The ideal treatment as of now is a lymph sparing water assisted liposuction, where the edematous fat is removed while protecting the lymphatic system, and this is done in stages. And once the edematous fat is removed from the body using the body jet technique, there is 85% relief of pain and other symptoms, and the bruising also reduces, and the person can lead a comfortable life for a pretty long period with very minimal amount of care.